Hello everyone, welcome back to the channel. This is Pawan. I'm a registered nurse working in one of the hospitals in Sydney, and in this video I'm going to talk about one of the most common questions I get asked from you guys on YouTube. What to expect in semester 1 of nursing school here in Australia. So in this video I'm basically going to give you an insight on how many lectures a week you will have, what are the lectures about, what sort of assignments you will do, and when do the clinical placements start, and a few little things that you need to buy before you start your semester 1 of nursing here in Australia. So let's get right into it. How many lectures a week? Well, it totally depends. It actually depends on two main things. Firstly, whether or not you're a full-time student, which means you will be studying 4 subjects a semester. So you will obviously have more classes than someone who is only part-time and studying only 2 subjects a semester. But for international students, you can only enroll in full-time. And secondly, it depends on the uni as well. Some unis have busier timetable than others. For example, the university I went to, we had classes like at least 3 to 4 times a week, which was hectic for some students. But for me, it was actually fine because I actually enjoyed going to the classes and learning new things. I was so excited about it. But if you're someone who's concerned about the timetable, you can always check with the uni you're applying to study nursing at and saying, look, hey, can I have a look at the timetable, or can you give me an idea of how busy the timetable is? And you can see whether or not that works for you. Now, what do you learn about in the first semester of your nursing degree? Well, the semester curriculum will vary based on your institution, but in general, you will learn about fundamentals of nursing, anatomy and physiology, Australian society and health, and also some basic skills around nursing practice. The first year of nursing degree is very science heavy. It is structured in a way so students can get a baseline knowledge of human body and how to care for patients. But the great news is they actually make you practice all the skills you learn in class in labs and tutorials. So let's say if you are in a classroom of 100 students, the class will be divided into 4 to 6 small groups, and the students in those small groups will go to these labs and tutorials together. And because the first semester is so science heavy, they keep the nursing side of things simple. So you will learn the basic nursing skills like how to do the hand hygiene, how to take vital signs manually, your blood pressure, pulse, and things like that. So you'll be taking each other's blood pressures and learning how to do that manually. And there will be mannequins as well for you to practice these things on. So basically the same nursing skills that we'll do on real patients. These labs are actually meant for students to ask more questions, to have more hands-on experience, and to basically apply all the things that you're learning in class into practice. And this is the best place to catch on mistakes, because mistakes will happen, but that's okay. You're here to learn. Now let's talk about the assignments in the first semester of your nursing degree. The assignments in the first semester are very essay based. So they basically give you these 1,000 word or 2,000 words essay to write. They will give you a topic and a detailed brief on what they expect you to cover in this particular essay. So I myself came from a background where we never had to write essays. It was all about examinations at the end of the semester. Like back home in India. So I had 0 experience in writing these essays, but I did figure out, so will you. So if you come from a background where you never had to write essays and you're really scared and nervous about the whole thing, there is academic support available on the campus as well, a person who you can go to when you're struggling with your essays. So don't be afraid, you will figure out. And at the end of the semester, you might have some examinations as well. Now, that totally depends on your university. For example, at Avondale, where I studied my nursing degree, they had a combination of essays as well as exams, which worked well for me because I was really familiar with the examination format. So you just basically study for the exam and appear for the exam and give the exam, and you're marked based on what you've written in the examination, which is great. But eventually I did figure out how to write good essays and how to reference correctly. So don't worry, if you come from a background of writing no essays, if I can figure out and I can do it, so can you. And as I said, there's always academic help available on campus, a person you can go to get some help in writing these essays. And during the semester, you might also have some group assessments where you are in a group of 3, 4, or 5 people and you are working together to complete a given assignment. And you will also be taught some basic math on how to do the drug calculations and calculate all the dosages. So they will basically provide you with all these formulas, and you might have a math test at the end of the semester as well. And when do the clinical placements start in nursing school? Well, the clinical placements are the first time you will be looking after real patients as a nursing student. So it's very exciting. Clinical placements usually start in the second semester of your nursing degree, but it can totally vary depending on which uni you're studying at. And you will usually start in a low-key area like a nursing home, and then you will progress towards hospitals and critical care later on in the degree. And it's usually Monday to Friday. You will usually have morning shifts in the beginning, which starts at 7, finishes at 3:30 in the afternoon. And you might have some afternoon shifts as well, which starts at usually 2:30 or 2 and finishes at 10:30 or 11 o'clock at night. And during the first clinical placement, you will be working on basic skills, basic nursing skills, like how to help patients with activities of daily living, how to do vital signs manually, and things like that. Now, what are the things you need to buy before your first semester of nursing? Well, as a university student, you will obviously be buying some stationery like notebooks, highlighters, pens, pencils, etc. But on top of that, as a nursing student, you will also need to buy a stethoscope, which you will need for your labs as well as your clinicals, your uniform, which will be provided by your university, and a good pair of comfy shoes that you will be wearing for your labs as well as your clinical placements, and whatever is recommended by your university. It's usually a pair of like leather or rubber shoes, which doesn't allow the liquids to seep through. Now, what are the things you don't need to buy? Well, this is a little bit controversial and it's a bit of a personal choice as well, but I'm just going to put it out there. So when you start your nursing degree, some lecturers will recommend you buy these nursing books, which are optional. And I saw when I was studying nursing, most of the university students went ahead and bought these expensive books, but you don't actually need them. I mean, yes, you need the books, but you don't actually need to buy the books because the library at the university had those books already, which you can borrow and return as needed. So you don't have to actually spend all these hundreds and hundreds of dollars to buy these books, which you're not going to use after you finish your degree. But if you're the kind of person who would really want to invest in books and, have them handy anytime you needed them, then I would recommend you going and buying a second-hand or third-hand book, because they're still books and they are much cheaper than the brand new books. Okay, now let's get right into the tips for semester 1 of nursing degree. Firstly, as soon as you start your semester, you will be given a list of assignments that are due for all those different 4 subjects. So what you need to do is you need to sit down and write it in your planner. What are all the assignments due and when they are due? For example, one might be due like in 4 weeks time, and the second one might be due in like 8 weeks time, and there's another quiz that's happening in between. So you need to know what's happening in all those 4 subjects. So make a planner. And the idea is to start working on these assessments as soon as you can, especially the first one. Don't leave all these assignments like until the week before it's due and then you start working on it, because your schedule will get hectic. And then you will realize, oh shit, I should have started working on it, a bit earlier, so I had more time. I mean, if I had more time, I would have done a better job and things like that. And especially if you're new to writing essays, just like I was, I would say start in early. And secondly, never underestimate the power of a good sleep. Oh my God, I wish someone told me this when I was back in like the first semester of nursing degree, because I was not getting a good night's sleep because I was living very far from the university. I had to travel like 2 hours by train to get to the uni every day for like 9 a.m. lectures. So I had to wake up like really early. And also like I was having these late night study sessions where, spending time on learning to write good essays. But you really need to sort of look after yourself and get that good night's sleep, because you really need it, especially for the first 2 semesters of your study. And thirdly, a good time management. I would say invest in one of those planners that we can buy from either Typo or Kmart in Australia. They are really good and really cheap, the student planners. So basically what you do is you get a planner, you write where all your assignments are due in how many weeks or whatever, and you can actually see it and you can put it on your study table or wherever. And that will actually help you stay on track of things. And lastly, eat healthy, exercise, and look after yourselves. Look, nursing is a busy degree and you might find it hard initially, but that's okay. Everyone does. But if I can get through, so can you. So guys, I really hope you enjoyed this video. If you did, give it a thumbs up. If you still have any questions about the first semester of nursing degree in Australia, you can leave it in the comment section below. And make sure you hit the subscribe button so you don't miss on any of my upcoming videos on nursing in Australia. Bye!